In tonight's Health Edge, a new study identifying 9 risk factors for Alzheimer's disease.
And some of these things could be preventable. Chief Health Editor Dr. Partha Nandi joins us now with more on this one. Doctor.
Yeah, it's pretty important. You know, what happens is 2/3 of all Alzheimer's patients point to these 9 risk factors. Let's look at the risk. You know, obesity, carotid artery narrowing, low educational attainment, high blood pressure, frailty, and also your smoking habits, high levels of homocysteine, and that's an amino acid, type 2 diabetes and depression. When you look at that list, you can see a lot of those things are preventable or at least treatable. And while this study is observational, it's important because 1 in 14 people over the age of 65 have dementia. So it's really important.
So when you think that someone has signs of dementia or Alzheimer's disease, what's the first thing you can do? Because a lot of times people are in denial. Family members are even in denial.
That's a great question. So what I would do is go to a professional, not just any doctor, doctors that treat this disease. So gerontologists or doctors that treat elderly folks, and say, listen, these are the signs that I have. And they usually give some testing to find out if that's true. Because sometimes people say, well, you know, I'm not quite sure. And so why take a chance? Because there's some medicines that can actually do something, not to go backwards, but to prevent progression. So absolutely.
Back to some of the risk factors. If you're treating type 2 diabetes, for example, does that lower the risk, or is it just the presence of the disease itself that can raise it?
So the presence of the disease actually increases the risk, but if you treat it, you can actually make an impact. So lots of people, you know, in their 50s and 60s that have diabetes, make sure that you get that hemoglobin A1C control. It's not just like, you know, my sugar's okay, but the long-term control is critical. I mean, we're not just talking about Alzheimer's, but, you know, what about your eyes and your heart? All the side effects of diabetes can be improved. So, go ahead.
And in addition to all of that, when you think about things that you can do at home, so if you do have a loved one who's suffering from Alzheimer's or dementia, you can do things, right, to keep their brain busy, like playing cards, or what are some of the other things?
Yeah, we talked about this at the break. You know, what we can do is, I think, give them familiarity. So if anybody has family members with Alzheimer's, you give them familiarity with past memories. So, you know, play music, play old songs they're familiar with, and like you said, you know, play card games, something that they can do. Not every single Alzheimer's patient has the same problem. So what you do is you find out what they enjoy and what they can do. You may not be able to talk to them about something that happened today or yesterday, but listen, you know what? You were in World War II, and remember that time, and they love to tell those stories. The key thing for those of you who are watching is that do not abandon your folks that have Alzheimer's, because one of the main things that happen is that they're left alone, and then the disease actually progresses when you do that. So give them company, give them familiarity, and let them know they're loved. I think that's super important.
Yeah, let them know they're loved.
Getting folks treatment too, as they start to present the disease, obviously a huge important thing here. Is that right?
The earlier the better. You know, you can't go backwards, but you can prevent it from going forwards, you know, more rapidly. So see your gerontologist, see your doctor, and say, this is what's happening to my mom, my dad, my grandpa, my grandma, and can we help with any medications? Or look at other factors that could make it reverse. So sometimes you could have diseases like thyroid disease or something else that they could actually treat.
Yeah, so many people suffering with it.
Yeah, it's really important study too, because we can now maybe prevent some of this stuff.
Absolutely. Thank you so much.
Thank
Dr.
you.
Nandi.
It's my pleasure.
And if you have a question or a health concern for the good doctor, you can email him at drnandi@WXYZ.com or send it to us on Facebook and on Twitter, and also the good doctor available on social media as well. Always loves to help people.